Give me a second. I am sharing right now my screen. So I hope you all are ready and you are prepared to do this. Okay. So um, welcome to day 4, as already said, to our amazing VICO. And as I said before, this is COVID-19 protocol. And as you know already, I am Lilo. I am 24 years young, not old, young. And Richard, the color of these slides are very beautiful. Why it was orange and not blue? I like this blue. So that's what I wanted to say in front of the entire plenary. But still, all the slides are very good. So today, there is nothing new in this session. Everything that I am going to tell you today, it's already written in our document, specifically in the safety guidelines or in the contract part itself. But please take notes still, because you will have to define some next steps. And if you are planning to have any EP, or if you are already thinking about going back to operations, because I know that some entities are opening borders, and in some parts of the world, the situation with COVID is a little bit better, you cannot proceed without having this. So for you to be aligned, if you hear from your MC, we are going to open or have realizations again. Yes, bitch, but tell me that you have these protocols, show them to me. If not, they cannot. And actually, you can report it to us. Cool. So the session is going to have 4 parts. Honestly, I don't think we will arrive to the 4th one, but you can start typing in the chat if you have any question. So I am going to give you context, protocols, and then we're going to have some mapping out for our EPs and a Q&A space. So for the context, we already know that COVID is terrible. We already know that it's been it's not that very close, but it's somehow close to the Black Death and to the Spanish flu and to very bad pandemics that we already had. So I am not going to repeat you all of those things. At this point, I think that specifically as youth, we are more concerned about things that we know and things that we don't know. And specifically speaking, and from my side, I think that the uncertainty for certain things kills me. I don't know about you, but I like to have things structured. I like to know how things will work in the future. So I think that as ISECR, this is like a collective perspective. So I want you to go to Menti. Here you have the QR code and also the number. And it's just one simple question that I am going to ask you, because we know the reality of COVID, right? But I want to know, how do you feel about this reality of COVID? So please go to that code. If someone can type it in the group, please, Raulito, 88979288. And it's just one question. It won't take long, maybe 1 minute. And is describe COVID in one word. I don't know if you're typing already, but I am not getting the answers. Oh, I am getting them. Crisis, challenge. You can type as many answers as you want. I delayed all of the limitations and all of the limits, so you can type as much as you want. Okay, so I will leave you another 10 seconds, I think, because you are getting very creative and you are sharing your thoughts. So that's cool. My dear Richard, can we have sharing about this? Because I am seeing and I am so happy that how people can describe right now COVID-19 is as an opportunity. This is the most frequent word, and I think this is amazing, really.
I'm taking screenshots already.
Amazing, thank you. Cool. So the most frequent word is opportunity, and I am so happy. But also we have some words like sadness, uncertainty. Oh, good. We are no kings of the world. This is true. I am sad to say, but we are nothing, literally. Virtual engagement, but situation, enjoyment, challenging, anger, life changing, challenge, empathy test, uncertain feelings, Christianidad. I don't know.
Crisis and opportunity.
Oh, okay, thank you. Scary, alone, nervous, being not prepared, vaccines, stay home, disaster. We have very humbling. This is really good. So thank you guys for sharing this. I think that one of the words that is repeating somehow is uncertainty, uncertain, scared, nervous, being not prepared. And somehow that is the kind of context that I want to give you today. So I need to, yeah. Guys, I am too bad with technology somehow. Sorry. And I am going to bring you some things, as I said before, about those things that we already know, but also some things that we don't know. So we know at this point that ventilation indoors matters. We know that mask and hand washing works. We know that the virus spreads exponentially. We know that the virus affects people differently. So it doesn't matter your race, it doesn't matter your age, it doesn't matter your gender, your nationality. This is like ISEC. It does not discriminate. The virus can damage organs and the vaccines are safe and effective. This is not a conversation for conspiracy theories, even you like them, but the truth of the fact is that the vaccines are working. And I think those things were hesitating for so long when we started to understand this virus, but those are things that we have right now. And if you see, if we were using these things like ventilation, like mask and things like that, we will be a little bit safer. The thing is, that there are some things that we don't know, and I am so confused or I am so worried and my phone is ringing. Give me a second. Sorry, because nobody's home, it's only me. So there are some things that we don't know. For example, the new variants of the pandemic. We have the Brazilian version, we have the Egyptian version, we have the British version. And the thing is that this virus is mutating every time that it gets a new person. And right now, we don't know what is the order of those mutations or how they are happening. We are trying to understand them, but so far we don't know. Another thing that we don't know is, okay, this is being detected also in blood. So can be in the future be spread by mosquitoes, for example. How this is impacting the world. Okay, we know that we have a reduction of the contamination levels in around 6%. You know, I like facts, so I read all of that in BBC News. But also, is this really bad? Because we are producing in a massive way things like sanitizer, like mask and so on, and we know that those things are not good for the environment. So how this is impacting the reality of this. Then we have what the next pandemic could look like, because we were not prepared for that. And I need to know, or I think that we all need to know how this will work in the future. And we also don't know how the virus will evolve. And we don't know the long-term effects, because this is something new and we don't know. We are going to have sequels in our body for the future. So I think that at this point, it's not about to think, oh, like, okay, it's about to think how many deaths we have and things like that. But it's also to think about how we can be prepared for the next step so this virus doesn't keep catching us with one step behind. So once say that, I am going to move to the protocol that we have already. And this is also not something new. This is also something that we have already since IPM. That was around July. So we need to think that this protocol is covering three main things, but the entire purpose of this protocol is, to the current global pandemic, we have some regulations. And as I said before, any entity that is running any exchange under any ISEC program needs to follow. If you, that's my dog, oh my God. If you are not following this, you cannot run any type of exchange. Nada, ¿qué pasa? The second one is, those regulations will be valid until IC, and we are going to review them before, so we are prepared to IC. But at this point, from here until July, you need to follow that, okay? And the last thing is that ICB and ECB, we will be the responsibles to track that these things are happening. So yes, I mentioned it that your MCs cannot do all of those kind of things, but you as ECB need to make sure that they know what is a safety guideline, that they know what are the minimums for a safety guideline, and that it's not like, oh my God, we needed to make a health management plan. What is this? Well, ECB chair explain to them what is this. Explain what are the minimums. And basically, we have a protocol structure, and this protocol structure has four main parts. The first one is to operations adaptations that I am going to explain. I am going to explain all of them. The second one is health management. The third one is risk management. And last but not least, we have EP safety. So we are going to start right now with operations adaptations. And we have each entity's OPS and IPS should be adapted to the external context and address the main concern of the EPs regarding doing the exchange during the pandemic. And here we have two main focuses. The first one will be the IPS, because incoming, and the second one will be OPS, because people will have to leave, because that's how exchange works. You go, you arrive. For the OPS, it's basically that the EP needs to be aware of all of the safety and health requirements and regulations before leaving. The explanation of the procedures will be followed based on the possible issues that arise and who to contact. So the EP needs to know what will happen in case that things happen. And the third, please give to them a list of resources for the people to educate them in case, for example, they get infected, who they have to reach. But once again, and I told this in the session of day 2, do not give him links from Wikipedia. Give them links that the WHO is approving, it's providing, it's delivering. Please educate our EPs and engage them to educate themselves, but with safety resources, please. For IPS, please make sure that everything that you are having is aligned with your country and territory regulations. So there are a lot of things, and remember we talked yesterday about contracts and so on. There are things that you need to adjust for your entity according how your contract is working. And then explanation of the procedures to be followed in case something happens with the project or with the pandemic. And then there is another part that it's SOPs. Guys, right now, all of you should be aware of what is an SOP. If you are not, please reach your MC responsible. Because the SOPs are the standards operation procedures, and all of the members should be involved in that are involved in ISX should be following they should be knowing what they are doing, you know? So they cannot send EPs abroad or be an EP manager and have no idea what is COVID, how COVID works, and what are the ways to prevent COVID. I know that COVID is easily spreadly and it's growing exponentially and so on, but there are ways to prevent COVID. So make sure that everyone knows this and that the members are able to downscale this information to any stakeholder. We are not only with EPs, we also have OPs and we have partners and we have a lot of people. So everyone that is involved with this needs to be involved with these safety measures. And last but not least, make sure that everyone is complying with the health and safety measures provided by ISX in order to participate on an ISX exchange. Now we are moving with the health management plan. For the health management plan, Okay, so there are 4 things that you need to know in here. My dog is going crazy because it's raining and it wants to go outside and it cannot because it would get flu. So the first thing is make sure that your entity have a health management plan, that it's following again the regulations, and everyone in this internship is aware with this plan. And easy features, the health management plan should include all of the actions that the EP needs to follow or that they need to have in order to participate for exchange. For example, it is mandatory to use masks or not. It is mandatory to use hand sanitizer or not. They have to report any symptom or not. They have to wash their hands every 3 hours or not. Those kind of things. Also, the requirements for the host to do before receiving an EP. So, for example, it can be for you as an OP, you need to provide, or you need to make sure that all of our workers or your workers, or if it's GB, all of everyone in the environment of GB, they will have social distancing, for example. This depends on how they are going to work. The action plans of the OP needs to do or have in place in order to participate of the exchange. So make sure that everyone knows the specific things that they have to do. And a plan of action in case an EP gets infected by coronavirus. We know that nobody wants this, but what will happen if one of your EPs, and this is a question that every part of ICX and OGX needs to know. What happens if the EP gets infected? First thing that you need to know, I am going to give you a clue. Is the insurance company taking care of the cost of the EP? Think about this, because this question leads us to the next part. That is basically the risk management. So for the risk management, every entity needs to have a risk assessment, but it's risk management, no risk assessment. So you have an assessment and you have an action plan. And this action plan needs to be applicable for internals and for externals. And this action plan should include what are the responsibilities with the partners. Can be sustainability, can be financial model, can be visa management. What will happen with any possible risk that we have as an organization? If you don't know how to make a risk assessment, you can go to Google and look how to make a risk assessment. And it's not that complicated, it's very easy, and it's super mandatory for you. It will take time because you need to make a very good assessment, but it is that. Then you need to think about what will happen in all possible situations. So there is a outbreak inside certain company, so the project will be canceled. What will happen? Here it says potential second outbreak, but we already are like in the 3rd or the 4th. So let's think about potential next outbreak. What will happen in that time? And what happens if the company goes to hell, so they bankrupt? What will happen for that? In your contract is saying that if the project is canceled, you have to refund the EP, you will have to, or not, for example, or you will have to change the EP for the project. What will happen in each situation, and think how likely is for these situations to have. Then we have a plan for managing EPs abroad in the case of the country lockdown happens again. So ICX side, what will happen if I have EPs finalizing the experience and the borders are closed? OGX, things what happen if your EP is abroad and in the middle of the project, they lock down the country. What are you going to do? Do you know the status of these EPs? Do you know if they're, once again, if their health insurance companies are going to cover this, how they're going to return home? So think about this, and once again, every member needs to be super onboarded with all of this plan. No one needs to know better this plan than the entire entity. At this point, there is no one person responsible. You are responsible to track all of this, but everyone needs to know. And then we are moving for the EP safety, last but not least. So I know that some of you are running right now accommodation with global host. I know some of you don't. So if you are using global host, that is what was known before as global family, or the OP giving free accommodation to the company, what will happen if the host decides, I don't want to do this anymore? They are in the entire right to do this. So what is your plan B? Your AP is arriving tomorrow, and the host just say that they cannot. What are you going to do with AP that is arriving tomorrow? Please have a plan B. Then Also, if you are having global host as main accommodation, make sure that the host knows what they have to do according to safety guidelines. Okay, are they going to keep a quarantine? Are they going to have masks, like wearing masks inside the house? What is going to happen? Make sure that in your safety plan, everything of this is covered. Then all EP contracts should be updated with the current context. So we already talked about that in the day 2 session, remember? But your contracts, not only for EP, but also for OP, needs to have things like included but not limited. 2, refund policies. So if the project got canceled because the EP got infected, who is going to pay? It's going to pay the organization, it's going to pay ISEC, or it's not, no one going to pay. Make sure that this is written in the contract, because if it's not existent, then it's not happening. So please prevent all of those kind of things. Make sure that the safety requirements are written in there. And of course, ISA responsibilities as all of the contracts. And I will advise you, like yesterday, I think we gave you some tips of which things that all contracts should have. But make sure that this lawyer receives the list and implement all of this. After having those comments in there, the lawyer can add as many things as they want, but at least those things. And another thing that is happening frequently is that, not now, but it used to happen before and it cannot happen now. We are sending some EPs and it's like, once you arrive there, you can handle your visa. Once you arrive there, since this visa only covered you for 6 months and it's 1 year, then you can handle your visa abroad. Don't. Make sure that each EP your entity is sending has the right visa for the entire duration. Because what happens, again, if the embassy says, I am not extending your visa, it's not the EP fault, it's not ISEC fault, it's a third-party responsibility, but it's not written in the contract who is responsibility for these specific cases. So that it's about EP safety. And now we are going to move to the mapping out. This tool that I am going to share, it's not new, but before going there, please share in the chat, write CISAs if you have EPs being physically realized, and type NOPI. I love Spanish expressions. If you don't have EPs being physically read. CISAs, you have EPs being physically realized. We have, okay, so we have some EPs being realized. Cool. The majority says CISAs. We have some NOPIs there. But now let's think if, write obvio, if you know how you can track the EPs that are being realized in a physical way. And you can write nonas if you don't know how to track EPs being physically realized. I don't know. Do you think it should be the same tracker as standard tracker? For example, obvio more, she was way too Colombian with the obvio and the more. But I see that people is not typing and I am not judging, but maybe you don't know how to track your EPs being realized, but no worries. We are here to have your back. So this tool, once again, it's not new at all. This tool was designed when we were having the outbreak, because you know that as ICB, we need to map it all of this. And this first months of COVID were crazy for Lua management team, but we managed. And here, here is the tool. Is a EP state COVID-19. Please go there. You are going to receive this in your outputs, of course, as everything that we are giving to you. You can have them in there. And this can help you to understand what is happening with all of the EPs that you have. The formulas are already done. So everything is covered. You just need to make sure that you are updated with your EPs, because we cannot update your EPs. We can just give you the formulas. So everything is done. And here you have some things of how to handle certain situations. And for the counter, for example, here, if you are OGX, how many EPs do you have according to EXPA in any situation? Also, is your EP logged? Is doing the project? Is already the home country? Right now, please keep this tracking tool until COVID is globally handled. not before, because at any point we can have again a new outbreak, or you can have border closed again, or anything can happen. And also make sure that everything with the visa and with the health insurance and everything is covered. So you also will have here if you need to have any compensation needed. You have the parts for ICX operation, so you will be able to understand if you need to compensate or not, if you need to postpone or not, if you need to break the situation. Like, this is only about COVID EPs, so you can adapt it. No, adapt. Yeah, you can adapt it if you want, of course. But my advice for you is to have this working and their standard tracking tool working. And this way, you will be able to understand what is happening with the EPs right now in COVID-19. This situation is not normal. This COVID-19 is not normal, so you don't need to act normal, right? You need to take extra care of your entities. And once again, remember that this is a must for you if you are having physical EPs being realized. And this is a must also if you are planning to have physical EPs being realized. So it doesn't matter if you are hosting entity, it doesn't matter if you are sending entity, because by the end of the day, it's about ISEC being responsible for the experience of the EPs. Okay, so that was it. I don't know if we have any question. I don't know, dear OC, how many times we have left, how many minutes we have left, or if we are already exceeding the agenda, or if there is any question, of course. Anyone can talk, it's fine. I don't bite. You are going to receive all of the trackers and all of the deliverables of all of the sessions in the output that is going to be sent by the OC by the end of the conference. And with isec.ed links and not the normal docs.google.com/a lot of letters. Go, Adim.
Hey Lilo, I hope you're doing well. Amazing session. I was able to learn a lot. One of my questions is that even though we're tracking EPs for the outbreak, what steps should we as ECB take if EPs get stuck? Like a realized EP gets stuck in a country and lockdown comes in place. So what are the steps that ECB will take?
I think as ECBs, you cannot handle to send the EP back to their home country because we don't have that power. But what you can do is that you can support the EP, for example, calling to the embassy, seeing what are the possibilities for this person to go back to their home country, or check for humanitarian flights. But this is a support that you need to give to your EP. So you can support them while doing this, but you are not the final responsible for this. What you need to ensure is that you know the situation of the EP. So, for example, once again, he got infected and he's in lockdown. So is the insurance company going to cover him? Those are things, or those are situations that you need to think as chair, and you need to make sure that your entity is aware of how to act in these cases. But if it gets locked down, like, honestly, I don't think you can send or you can move strings to send them back home. You can track how the things are going, and you can support them getting support, or from the embassies or from the consulados. I don't know how to say that in English, but the government, the parties of the places in charge of international affairs.
Okay, Lilo, thank you so much.
Any other question? Like, do we have time for more questions, OC? No, cool. So you're going to receive the output. If you want to know anything about safety guidelines and about COVID, just call me. I am your girl to help you throughout this. And the session will be